Good morning, friends, and welcome to another episode of 10 Minutes with TmFal. This morning, we're going to talk about the importance of screening and keeping up with age-appropriate recommended health screenings. So, in medicine, we talk about screening for certain health conditions, and the definition of a screening exam or screening test is to identify a condition before it causes symptoms or before it causes clinical illness. So really picking something up at an asymptomatic stage. And examples of that include, annual blood pressure screening. So you can pick up, hypertension before it becomes, severe or someone presents with a stroke, or breast cancer screening at a certain age, colon cancer screening, cholesterol checks. So these are things that are put in place based on what we know about disease conditions, where you can check for them and screen for them to diagnose them before they cause symptoms and manage them or prevent worsening at an earlier stage before it becomes symptomatic. So for definitions of a screening test, it has to be a condition that is it has to be for a condition that has public health implications. So a lot of people are affected by it. The screening test has to be easy to perform. It has to be cost effective. It has to be relatively easy to access. And it has to make a difference. So there should be a difference in picking up this condition earlier in terms of ability to cure it or to change the course of the disease or to even prevent it from happening. Things like pre-diabetes or early hypertension, where you can actually change diet, exercise, food intake, and change the course of developing that condition. So, we talked about screening tests have to be easy, they have to be reliable, they have to be valid, they have to be easily accessible and available. And examples like we talked about, things like blood pressure checks, cholesterol screening, breast cancer screening with mammograms, colon cancer screening. Those are all things that we should be doing, and they're usually very clear guidelines, including screening for things like infectious diseases like HIV, like hepatitis C, where we know that you can screen when people have no symptoms, diagnose them early, and put them into a treatment for hepatitis C, where you can actually cure the virus and improve the liver outcomes. And for HIV, where you can put people on treatment and prevent long-term complications. So the importance of screening is when you do that, you already get diagnosed with something early. And if you don't have that condition, you're put into a screening regimen so you know when next you need that screening test. And again, it improves outcome overall. But what I've seen in medicine and what I've seen in my regular non-medicine life is a lot of times women especially, we're not good about keeping up with our screening for different things. But I'm going to focus in on our mammograms for breast cancer screening. So we already talked about why it's important, right? So if you pick up a lesion on a mammogram before it causes a lump that you can feel, before it causes any kind of symptoms, you're more likely to have a better chance at a cure, early management, and a treatment protocol. But a lot of times we don't do that. And come to think about it, some of the reasons, the top 5 reasons I've heard why people don't keep up with their screening tests, and we'll focus on a mammogram, although we can apply this to other screening conditions, these are the top 5 reasons that I've heard. One is that I'm scared, and so this is that avoidance thing. I don't want to know. What if it's abnormal? I'm scared. The second is I don't have time. I'm working, the kids, I have so much to do for my parents, for my children at work. I can't take time off work. So the second is I don't have time. The third is it's not my portion. So this is kind of there's no breast cancer in my family, or there's no high blood pressure in my family. This is not something that's going to happen. So, if I go start looking for it, I might wish it on myself, right? So that's another reason. The fourth one is it's not a priority right now. Some other time when when I have more time, things are more settled and work is good and the kids are good, then I'll start talking about my own health screening. Right now I have no symptoms, so my health is not a priority. And the fifth is, it's not convenient or it's painful. So people say, I don't like getting blood drawn for like the whole pre-diabetes cholesterol check. Mammograms are painful. Yes, they are. But you can take a Motrin, and it's one time every year. So those are the top 5, and I'll kind of go through each of them and dissect that. So one is you're scared. That's understandable. However, ignorance is not bliss, and what you don't know can hurt you. So if there's a lesion in there and you're scared and you don't get that mammogram, that lesion is still there. It's going to grow, it's going to spread. And talk about being scared. When you get diagnosed with an advanced disease, you're going to be even more scared. So being scared and avoiding a mammogram or avoiding a health screen, avoiding a colonoscopy is not a good enough reason not to do it. It's valid to be scared. Read up about it. Find somebody who's gone through it. Go with them. Because once you get that first screen, you're more likely to keep in touch and keep in place with getting other things done. The same reason why people don't get an HIV test or a hepatitis C test. Well, all of these things are reasons why, if you do have the condition, picking it up earlier is always better. You're scared, but the implications of more advanced disease in any of those conditions is worse. So being scared, but we can work on that. Second is, it's not my portion, which is if I don't think about it, if I don't wish it, it's not going to happen. And if I start looking, it just might happen. Well, that's not how things work. So it's good to be spiritual. It's good to be religious. It's good to pray that your health is intact. But there's a reason these tests were described. There's a reason they're doctors and people in healthcare. So get your screening done. You can still pray, and that does not negate your faith. But having that as a reason not to get screened is not a good thing. The third is, I don't have time. And this is something that I hear a lot from friends, from women, from moms, is I don't have time. We're all very busy, taking care of kids, taking care of ourselves, taking care of family, taking care of parents, making sure work is good, being a good friend. But a lot of times we don't leave the time for ourselves. You have to prioritize yourself, because these kids and these parents and everyone you're taking care of, when you actually get sick, or if you're ill or you have more advanced disease, you definitely won't have time for them. You'll have less time for them. And now all of a sudden you're putting a lot of burden on these little ones to care for you, to be there for you. So one time to get a mammogram, to get your colon cancer screening, to get your blood pressure checked, your diabetes screening, your HIV test is important. To make that time, to schedule that time, make it a standing thing on your birthday month or the first month of the year. Pick a time, make sure it happens. Not having enough time is not an excuse. The fourth is, it's not a priority, which means right now I have no symptoms, which means until everything else is good, until I'm done hustling for work and the kids are good and college and stuff, then I'll start taking care of myself. That's not a good way to go. If you love your family and love the people around you, those things and those people you have made a priority, that's another important reason for you to get your health screening. You want to be healthy for them. You want to be healthy for them. You want to, if you have any conditions, you want to get them diagnosed and put on treatment to alter that course so you can actually be there. So making yourself a priority for health screening and taking care of yourself is actually loving the people that you care about. And it's important to know, no matter how great you are at work, no matter how awesome everybody thinks you are, if you get sick, if you're out of commission, if you're out of circulation, if you're in the hospital, in a couple of days, your job roles are reassigned. In a few weeks, somebody else has your position. And sometimes in as early as 2 to 3 weeks, no one remembers you were there. may get flowers at the hospital. So it's important to figure out that you need to take the time to take care of yourself, and not just when you have symptoms, not when you have the headaches from the high blood pressure, not when you have the infection from the untreated diabetes, not when you have a lump because you haven't had a mammogram. So important to make yourself a priority. And the last reason, the fifth one, is it's painful, it's inconvenient, I have to be fasting for blood work. Well, if you think about the pain of a mammogram versus the pain of having to go through a treatment for advanced disease, which would include sometimes surgery, radiation, chemotherapy, multiple blood draws, multiple times when you're fasting for tests, times when you can't do things for yourself, that in that grand scheme of things, the pain or inconvenience of that screening test clearly really does not come anywhere close to picking up something much later. So those 5 reasons: I'm scared, I don't have time, it's not my portion, it's not a priority, it's too painful. Those are not good enough reasons not to get your health screening. So I'm again imploring women who are listening to me, at any point, please keep up with your age-appropriate screenings. Make sure you get your pap smears and all the things you need to get done, your blood work, and make your health a priority. Because when you're screened for a condition, you can pick it up early. You're more likely to go in for further screening as recommended because you've gotten over that initial anxiety. You can do a better job. And when this happens, when you don't go into avoidance mode, this applies to screening in other conditions. So this has been 12 minutes with TmFal, and this episode is about keeping up with our health screenings. It's really, really important because it makes a difference. Thank you for listening.